Welcome back to TV5 News at 9. Joining us this morning is Chris Harrington and Dr. Delisha Pruitt from the Saginaw County Health Department. Thank you so much for being here. We appreciate it.
Thank you.
Of course. Good morning, Dr. Pruitt. Today we are talking about COVID-19 vaccinations. We are so excited to hear that more and more people are getting vaccinated, and we want to keep that trend going. So first of all, tell us, what are some of the common questions and concerns that people have about the vaccine, Dr. Pruitt?
Well, Colette, some people are concerned about infertility. That's a myth that's been going around. And so people of childbearing ages, both men and women, are concerned. And then some parents are concerned about, are their kids going to be a guinea pig if they get the vaccine? What are the long-term side effects of the vaccine? So these are legitimate concerns, and these are concerns that people have that they are asking questions about right now.
Yeah, that's very important to know those. Now, Chris, I want to turn to you. I'll come back to you, Dr. Pruitt, in just a moment. Chris, what are some concerns you most about the information that people are getting and using to support some of the myths circulating on social media?
Yeah, it really is concerning when we've heard people say, I've done the research and I've decided not to get vaccinated. And then when we find out, where that research was done, we find it's not always research. I think that is because there's so many myths and misinformation circulating, particularly on social media, and it's really taking hold. Sometimes it could be just someone's opinion that gets shared and shared and shared and shared, and pretty soon you start to hear that it's sort of the new thing out there, and then we hear those questions like Dr. Pruitt just mentioned.
Yeah.
So we want people to know that research isn't always something that you just read as an article, but that people really need to look at reputable sources of research. Places like Centers for Disease Control and Prevention or the American Academy of Pediatrics. These are places that really are grounded in science and participate in the research and then can share that reputable information. So, we just want to try to reduce the confusion around, what has been taking hold over social media.
Yeah, it's very important to debunk those myths. And Chris,
Yes.
Also, you're hosting a phone bank this week. Tell us about the phone bank and why you're doing it.
Yeah, so, part of getting questions answered and being reliable sources of information, that's why we want to do the phone bank.
Yes.
So, people are really smart, and families, obviously, everyone is, very concerned about the health of their friends and their family, and that's really important. We want people that have legitimate questions, want to provide them an opportunity to get them answered. So we have pulled together a team of physicians representing family medicine, infectious disease, pediatrics, obstetrics, and even emergency medicine. So on Wednesday during the news hour, people can call in and ask any of these experts any of their questions that they have around COVID, the safety, the efficacy, the questions that Dr. Pruitt just mentioned a minute ago. If they have questions relative to that, they can get them answered right then and there.
I love it. All of the different experts right there that you can get your questions answered. Thank you so much, Chris, for that. Now, Dr. Pruitt, if people still have questions or concerns, what should they do right now? They're contemplating getting the vaccine.
So if you guys have some concerns, what you really want to do is reach out to your healthcare provider.
Yes.
Don't forget that they are a legitimate source of information for you, in addition to MDHHS and the CDC. And don't forget the Saginaw County Health Department website page. We have good information for you. And then go to your doctor. Ask the questions that you have. Remember, it's okay to have concerns. It's okay to say, will this harm my child long term?
Right.
Talk to your doctor, someone that you can really trust, that you've had a long-term relationship with, so that you can feel comfortable making the decision to give your child a vaccine, or to give yourself, or if you're pregnant, to possibly even give your unborn child a vaccine.
Yes.
With you and yourself a vaccine. So please talk to your doctor about any concerns you have, because they can help answer some of those concerns.
We love it. Thank you, Chris. Thank you, Dr. Pruitt. I know the message is to get vaccinated. Do not hesitate. Thank you so much for joining us this morning.
Thank you for having us, Colette.
Of course, you're welcome. And don't forget, all of your questions answered. The phone bank is Wednesday, June 16th from 5 until 6:30 p.m. And for more information, just go to the hot link section at WNEM.com.